Welcome to the Shatkin First Monday Morning Minute.
Good morning, and I'm Dr. Todd Shatkin. We're going to be placing some mini implants to make an upper and lower roundhouse for this nice lady who we have sedated. And this was recently scheduled, so we didn't have a lot of time to do a surgical guide, but what I'm going to do is use a marking pen, and I'm going to mark the locations of where I want to place these implants. And we'll take a look at the x-ray in a little bit here. But I like to mark it in the areas where I want to place these. On the upper, I'm planning to put 10 implants in because the sinuses are pretty low as you get way toward the posterior. So 5 on each side. Then 2 511s in the posterior. I like to puncture through the soft tissue with the pilot drill and then start the drill motion so I can feel the top of the ridge. Notice I have my finger on the buckle to avoid perforating the buckle plate. Okay, here's our first hole. You can see the bone on the tip of the pilot drill here, and that's a good sign. That means she's got good bone now. You heard the beep there. We just got 30 Newton centimeters of torque. Let me take a look at the x-ray with it. Good. All right, you will go ahead and do the next one. Again, you see the bone on the tip of the drill? That's a good indication, because if you don't have any bone on the drill, then you might not be in bone. Okay, we got good bone density, but it did not beat, but I can feel the torque resistance, so we're probably right around 20 to 30 Newton centimeters. Not quite at 30, but that's okay because we've got multiple implants we're splinting together. So I'm going to go ahead and do the next pilot hole. This bone feels really good there. I'm going to go ahead and do the next one also. So 113 and 111, please. Don't forget, we're using the Shatkin First Intralock Osseon coated mini implants. The Osseon coating encourages bone regeneration and growth much more rapidly than implants without the Osseon coating. There's lots of research to back that up. Okay. Mr. Robin? But Terry. And one more 11. And you generally get good bone. How long have you been wearing dentures for?
6 years.
6 years? 7 years? Around 7 years? Yeah. Okay. Two holes.
Push out.
Oh, good.
All right.
I thought you said like
the ASEAN coding in the video.
Yeah. So, as I mentioned, the ASEAN coating is unique, patented surface only available on the Shatkin First Interlock implants. And that is the calcium phosphate impregnation into the titanium that, and also on the surface of the titanium, that causes bone to integrate with them very rapidly. That make two holes? Yeah, let's do the next one. 13. Calcium and phosphate are the two minerals that bone is made of. So by mimicking the chemical nature of bone, is that 11 or 13? It causes the bone to fuse to the surface. And this has been a product for many, many years now with Interlock implants. Dr. Terry Giorno developed the ASEAN coating and patented it about more than 15 years ago now, I believe. Let's see, it's what comes in around 2007. Two holes. 1, 2, 5, 13, and then deal with options, right? Many of you met Dr. Terry Giorno at one of our seminars here in Buffalo or elsewhere. But he's a brilliant scientist and dentist. You hear that beeping? That's good. We got 30 centimeters of torque. Charles. Go ahead and make the next.
You did already.
Sure, her bone is good. 1, 2, 3, 4. One more to 11. Lauren, will you take her denture, look her one time, and trough this denture off for me?
Yeah. Message. Yes. Great time. Whatever you took here, gonna go through the shoot. Yeah. There's
So what I'm gonna do is I'm gonna take an impression in the denture and have the lab pour it up while she waits and while we're doing the lower teeth, so that it'll save a visit and we'll have a good bite because her upper denture is So what I've done is I've taken an impression in her existing denture, and we're going to use this as her temporary liner. While the lab is working on her new teeth. Where does she live?
I don't sure we're called take ever to the
Yeah, we will. We'll take the final impression after we go to the bottom, and I'll take it all.
Okay.
Okay, I'm going to mark the lower now.
Jump become that fine. Hey, yeah. And see.
Yeah. You try it. Right?
Yeah.
A slight facial tip to stay away from the lingual fossa. So you angle those a little bit toward the facial. Remember, it's a very narrow ridge. I'm going to do a few rolls now. One. So 2 rolls. The trim and cut, or you can swing to cushion.
I'll believe it is cemented.
Let's do this.
Huh?
To the bone on the end of the pilot bill. Journey most today.
in this.
Got a little deep at the end there.
Different.
One more 15.
He's the one with cotton, does it?
Maybe. Just go for stuff. Smart. Okay, 2 holes for a button. Against it. You know what we're gonna do. Okay, one more. The bone's a little better base there. More dense. Okay, let's do the other 2 on the left side. And that'll be it. Turn on top and turn on the bottom. There's more. Just gonna post out CT. Wypoczyncie stolika na strag. Where's you have to
Doesn't have to be common though.
not yet. We're just seeing
Fine.
close together. And we're just gonna use the register open.
labor.
Or to sew again? The physician takes the impressions. Take everybody together and hold that just like that. Okay? So these are going to be her temporaries. They're going to keep these in pretty much all the time for the next couple of weeks. And we're going to have her permanent teeth made. Open. Living better. And what's chum. This is an option to do rather than putting housings in. You can just use a registration material as a reline temporarily. And that'll hold the bridge in place and also allow the tissue to heal. Right together gently. So this is the Shatkin patented cotton roll bite. Not really patented, but this is how I do a bite when I don't have any bite rims. I call it my 2 cotton roll bite. We have her bite together. Are you getting the inside here?
Yes, I am.
Both.
You can see them.
Okay.
Mm-hmm.
So what I do is have them bite together just like that. Keep biting, don't open, okay? Don't move. Just like that, okay? Hold it just like that. Okay, keep biting for 30 seconds.
Mm-hmm.
All right, don't open.
Not like that. The light is. That one. That one.
Dr. Matthew Lasorsa will be doing an LPRF course in Orlando, and you can find this information on our website on November 8th. It's a one-day course. It's on a Friday, and anyone who's interested in learning about the LPRF and how fabulous it is, please attend that course. On the 21st, 22nd, and 23rd, we're going to have an advanced mini and mono implant course. Dr. Gordon Christensen will be joining us on Friday, and Dr. Matthew Lasorsa will be coming up from Orlando to do a problem-solving course. Don't miss that one. It's going to be absolutely awesome. Call today to sign up. You can call any of our sales associates at Shatkin First, or you can visit our website at shatkinfirst.com.